Would you like to live to 100 in good health and vitality? A single consistent daily habit can significantly improve your quality of life and help you remain active for years to come. Today I will present 10 practical, easy to follow habits you can start right away. Shall we begin? First, make regular exercise a habit. Exercise improves cardiovascular health, reduces body fat, and maintains strength and flexibility, lowering the risk of falls. Current guidelines recommend at least 150 minutes per week of moderate aerobic activity, such as brisk walking or light cycling, or 75 minutes per week of vigorous aerobic activity. You can divide this into about 20 to 30 minutes a day. Include strength training at least twice a week, such as squats, push-ups, or dumbbell exercises. Small activities like walking during your commute, taking the stairs, or a 10-minute walk at lunch add up. Home yoga or stretching helps improve flexibility and reduce stress and is recommended as a complement. If you have chronic conditions such as joint or heart disease, consult your healthcare provider before starting exercise. Second, follow a balanced diet. What we eat shapes our bodies. Emphasize vegetables and fruit, whole grains, nuts, and healthy fats like olive oil, similar to the Mediterranean diet, and reduce processed foods, saturated fats, and excess sugar. For example, choose oatmeal with fruit for breakfast, a salad centered on vegetables with fish, chicken breast, or legumes for lunch, and roasted vegetables with a moderate portion of protein for dinner. Reduce eating out by preparing meals at home, and check nutrition labels for sodium when buying packaged foods. Calorie and nutrient needs vary by age, sex, activity level, and pregnancy status, so adjust to your individual needs. Note the cardiovascular benefits of olive oil and nuts shown in the pre-dimed study. Third, get sufficient, good quality sleep. Most adults should aim for 7 to 8 hours per night, though individual needs vary. Keep consistent bed and wake times, reduce smartphone and computer use and bright lighting at least 1 hour before bed. Avoid late afternoon or evening caffeine, and limit naps to 20 to 30 minutes. Keep the bedroom dark, quiet, and at a comfortable temperature. If you have persistent insomnia or excessive daytime sleepiness, consult a sleep specialist. Fourth, stay well hydrated. Fluids are essential for temperature regulation, waste removal, digestion, and skin health. EFSA's recommendations are based on total water intake, including water from food. So the amount you need can vary depending on your environment, activity level, and whether you're pregnant or breastfeeding. Build habits such as a glass of water when you wake up and a glass before or after meals. Add variety with lemon water or herbal tea, but avoid added sugars. Be mindful that excessive caffeine and alcohol increase fluid loss and can worsen hydration. Fifth, manage stress. Chronic stress is linked to cardiovascular disease, metabolic disorders, and depression. Practice 5 to 15 minutes daily of meditation, diaphragmatic breathing, walking in nature, or light physical activity. Hobbies like knitting, painting, or playing an instrument provide psychological stability and a sense of accomplishment. Break stresses into manageable steps, and seek counseling or professional care when needed. Sixth, strengthen social connections. Social ties lower the risk of depression, increase life satisfaction, and are associated with reduced long-term mortality. Keep regular contact with family and friends and increase face-to-face interaction through community groups, clubs, or volunteering. Digital communication is useful, but combine it with in-person contact when possible. Start new relationships in small groups and maintain them with everyday attention, empathy, and keeping commitments. Seventh, keep up with regular health screenings. Follow screening recommendations based on age, sex, and family history. routinely check blood pressure, blood glucose, lipid profile, and body mass index, and get age-appropriate cancer screenings, such as breast, cervical, and colorectal tests. Also maintain dental, vision, and hearing checkups to support quality of life. Screening intervals and tests vary by country, so follow local guidelines and consult your provider for follow-up or specialist referral as needed. 8th, avoid smoking and limit alcohol. Smoking greatly increases the risk of cardiovascular disease, respiratory disease, and cancer. Use nicotine replacement, smoking cessation clinics, or professional counseling when quitting. Reduce alcohol intake and avoid exceeding recommended limits. Guidance differs by country, and women and high-risk individuals have stricter limits. Strategies include keeping a drinking diary, preparing non-alcoholic alternatives, and planning how to handle social situations. Replace smoking or drinking with exercise, hobbies, or social activities to improve long-term success. 9th, maintain mental vitality. Cognitive health depends not only on memory exercises but also on curiosity, problem solving, and emotional regulation. Focus on activities that build flexibility, creativity, and resilience as well as memory and concentration. For example, reading across different subjects, listening to varied music, writing creatively, or keeping a journal broadens your thinking. Practice solving problems using multiple approaches. Emotional regulation and self-awareness training greatly benefit cognitive health. For example, try a 1-minute daily mindfulness practice focusing on your breath, or keep an emotion journal to track mood changes. When you feel angry or anxious, rate the intensity of your emotion on a 0 to 10 scale and summarize the reason in one sentence to help calm down. After setbacks, reflect on what you learned and what you will do next to build resilience and reduce repeated mistakes. Cognitive stimulation can be solitary or social. Discussion groups or book clubs broaden perspectives and strengthen social ties. Taking on new responsibilities at work or in hobbies helps develop real-world problem-solving skills. As a small habit, set aside 10 to 15 minutes each day to think in new ways. Also, once a week, read about a new topic or discuss one with others. Consistent effort improves memory, reasoning, and emotional stability. 10th, cultivate a positive mindset. Keeping a gratitude journal, noting 3 positive events each day, and practicing encouraging self-talk help manage stress and build resilience. Optimism relates to greater life satisfaction but should be paired with realistic problem solving. Acknowledge small achievements and express gratitude to others to improve relationships and psychological well-being. Small daily habits shape your future. Choose one habit you can start today and practice it consistently. Exercise, balanced nutrition, sufficient sleep and hydration, and stress management form the foundation. Stay connected, attend regular screenings, and practice smoking cessation and moderate drinking. Small beginnings lead to big changes. Take one step today. This presentation was brought to you by Health and Medical Info Hub. Thank you.